have had several consultations for a facelift with differing opinions. It has left me very confused. Any suggestions? I have 8 years of stress and grief written all over my face after caretaking of my husband who just passed away from cancer. I cannot afford the $20,000+ plastic surgeon. I am most comfortable with charges. What would be the most effective and long-lasting type of procedure for me? I have heard everything from limited undermining with fat grafting, extended SMAS, myopexy, which I thought was an integral part of the tightening and repositioning of muscle during a facelift, upper and lower blephs, brow lift.
Thank you for your question. You've submitted a question that certainly makes a lot of sense as to why you are so confused. You have gone through a tremendously stressful period in your life, and you shared with us in this question about taking care of your husband before his passing away, and that you are now confused about which way to go. You stated in your question that you're comfortable with a particular cosmetic surgeon, however, you can't afford the $20,000 plus price for the surgeon. And so you've gotten additional opinions, and you're getting all kinds of terminology, including fat grafting and other things that are being recommended, and now you're looking to find a solution that is right for you. Well, first of all, from the photos you submitted, what appears to be the concern that you're trying to address is the relative sagging and descent of the cheek and the loss of the definition of the jawline as well as the skin under the neck. I think that seems to be where you're focused on. And so in terms of a solution that is right for you, you can go and get lots and lots of opinions, but I think a lot of those opinions are going to be shaped by the budget that you're prepared to invest in. And as a specialist in facial aging and as a cosmetic oculofacial plastic surgeon for over 20 years and dealing with many situations of people like yourself who have gone through so many stresses and they just want to feel better and they want to just feel good when they look in the mirror, I have to say that one of the unfortunately bad decisions that happen is when someone decides based on budget to make a choice on which doctor they go to. There are hard truths about cosmetic surgery, and one hard truth is that there are a lot of costs to delivering care in cosmetic surgery. Surgeon's fee, anesthesia, facilities costs do add up, and that's just the reality. And whenever someone offers you a lower price solution for something that another doctor is offering at a higher price, the question you should always ask is why? Why are they offering you something so much lower than a colleague who's offering it at a higher price? And it's always easy to believe that the stereotype of cosmetic surgeons as having high lifestyles and charging a lot of money, but there are some very hard costs that ultimately put a cosmetic surgeon in a position to either charge a certain level to do high level of quality work or charge considerably less and try to do volume. From my perspective and my experience of over 20 years, I find that any doctor or surgeon who does volume work rarely does high quality work. They do good enough quality work. And why is that? Because we're all human. And the artistry of cosmetic surgery requires focus and time. So if in the same time that it takes me to do, let's say, upper and lower eyelids, face and neck lift, cheek implants, chin implant, that kind of surgery, if I have to do 4 of those, then you can imagine that it's going to be a very different experience for the fourth patient as it would be the first patient. And when you have that kind of pressure, doctors and any surgeon will confess that it is very difficult to be a factory worker and do high quality consistently. So in my practice, we actually are more about the quality and the boutique style and trying to perform exceptional procedures for each patient. So I think that what your challenge is that if you like this doctor and you feel comfortable, then this doctor may be able to counsel you on some less expensive options as long as you're willing to do something that will maybe be less expensive but give you be satisfying for the major concerns you have. But I would caution you not to go with price. There are many companies that have been proliferating to try to tap into the very lucrative market of cosmetic surgery that have been trying to do high volume, and you'll recognize them from infomercials and very convincing, compelling marketing messages. But when you learn about what's behind that thin veil of gloss, that the quality is just not there. And so I would say either figure out a way to invest the right money with the doctor who you trust and you're going to get the results you want, but avoid doing a shortcut procedure that's going to be less expensive. We see patients who come from all over the world who have had these types of shortcut procedures, and in the end, if you don't have a beautiful, crisp jawline, a nice, smooth neck, then you're not going to be happy. So I want to just suggest to you that you don't do anything in haste and that you think through your process of what your priorities are, and of course look at your budget. And you may just want to defer the procedure until you can afford it so you get it done the right way. Unfortunately, when people have cheap cosmetic surgery and they get bad results, they end up spending multiple times the cost, if they can afford it, to correct the procedures that they had that did not turn out the way they hoped. Fortunately, the realities of life is you never get something cheap that's equal in value of something expensive. I don't. That's unfortunately a rationalization and a myth that is practiced in terms of the predatory behavior of companies or entities that try to take advantage of people's desire to look good, but who don't have the financial means to invest in quality. So I think that you should once again go back to the plastic surgeon or cosmetic surgeon who you liked, discuss your issues and concerns. There may be some flexibility from the doctor's perspective, and at the same time develop that relationship so you can actually start in your healing process from your long stressful period. So I hope that was helpful. I wish you the best of luck, and thank you for your question.